NuvoAir, your specialty care provider for people with chronic heart and lung conditions. Too many patients with complex heart and lung conditions aren't getting the help they need, so we've built the next generation of cardiopulmonary care to ensure no one is left behind. We provide ongoing and personalized specialty care for patients with complex chronic conditions like COPD, congestive heart failure, and asthma that improves outcomes while lowering the total cost of care. Our care model consists of 3 key elements. Personalized care. We tailor care plans and clinical interventions to each member's unique needs, motivations, and risk profiles. Proactive monitoring. We continuously monitor members through cell and Bluetooth-enabled devices, passive biomarkers, and self-reported questionnaires to track changes in lung and heart health over time without being intrusive. Virtual clinic. Our multidisciplinary team meets with patients virtually during all hours of the day to close care gaps, provide comfort, answer questions, and administer timely clinical responses. Our clinical team prevents exacerbations with the help of our analytics engine, which predicts flare-ups using data collected. Real-time clinically relevant data helps us choose the right clinical intervention, adjust care plans, and prevent avoidable trips to the hospital. Let's see it in action. Meet Anne, a NuvoAir member who's living with stage 3 COPD. She was also recently diagnosed with congestive heart failure. After being referred to NuvoAir by her primary care provider, Anne is onboarded by a health coach who meets with her virtually to discuss her symptoms, needs, and goals. She can then meet with a dedicated team of nurses, respiratory therapists, pulmonologists, cardiologists, and more whenever she needs help. Within a few days, Anne receives a kit of devices based on her diagnoses and needs. Her kit includes a spirometer, a pulse oximeter, a blood pressure cuff, a connected weight scale, and an activity tracker. Anne meets with her NuvoAir care team, who teach her how to use her devices and help start her on a virtual pulmonary rehab program to help her improve her lung function and feel better. Because Anne uses her devices consistently, she and her care team can see how her health changes over time and can adjust her care plan accordingly. Now let's look at what happens when potential alerts are detected. When our algorithm detects early signs of an exacerbation, it alerts the NuvoAir care team. A member of the team contacts Anne so they can decide on the appropriate course of action. In Anne's case, her data suggests she may be developing an infection. Based on the information we have available, our care team will guide her through her treatment plan. We set her up with a same-day appointment with a pulmonologist who can evaluate her needs and write her a prescription so she can be treated early and potentially avoid a costly trip to the emergency room. We also notify her primary care team about her health to ensure there are no gaps in care or coverage. Anne's story is just one of many possible patient journeys. By personalizing care and leveraging data-driven insights, NuvoAir drives improved outcomes for patients with complex needs. As a result, we've achieved significant outcomes across our clinical service, including an 80% decrease in hospitalizations and a 60% decrease in exacerbations. On top of that, nearly 90% of patients report improved confidence in managing their condition. Our unique care model helps health plans and providers deliver value-based care for cardiopulmonary patients, improving STARS and HEDIS measures while reducing the total cost of care for complex diseases. To learn more about how NuvoAir can help your patient population, contact our team today or visit us at NuvoAir.com.